let's move on to the first question, which is how much cover do you and your family really need? Is it 5 lakhs? Is it 10 lakhs? Is it 20 lakhs? Is it 50 lakhs? Well, to be very honest, there is no simple answer to this. There is no one-size-fits-all solution to saying, hey, this is the amount of cover you need. Why? Because it's a super personal preference. Now, there are some people who would be happy to get their medical care from a hospital next door, whereas I know people who say that they would settle for nothing less than the highest end hospital in the city. Now, obviously, the cost of a medical treatment is going to vary depending upon where you get your treatment done from, right? But hey, I promised you simple thumb rules, so I'm going to give you a thumb rule for calculating and rather deciding on how much medical cover you really need for your family. So here goes the thumb rule. Ask yourself, one, what's the cost of a bypass surgery, a CABG surgery, also known as a coronary artery bypass graft surgery, in the city of your choice, in the hospital of your choice? That's the first question. Now, this varies widely. There are CABG surgeries that can be done at 70,000 and it goes all the way up to 6 or 7 or even 8 lakhs. So figure that out first. Now, multiply that by your number of family members. So let's say you figure out that the cost of a CABG surgery in your city, in the hospital of your choice, is 5 lakhs. And you've got yourself, your wife and your 2 kids, right? So 4 family members. So multiply 5 lakhs by 4. 5 fours are 20, right? Consider this your baseline cover. This is what you got to work with. So this is, at least we were right at a number, right? We're a few steps ahead of where we were, where we were completely clueless about how much health insurance we needed for our family. Now, is this 20 lakh cover the right number? Well, it's up for debate again, because there's another very, very important factor to consider, and that is your family's health condition. This is a bit of a qualitative lens to look at things, mind you, I do agree. Ask yourself what your family's history of medical illnesses are. How many times has any one of your family members actually been hospitalized for some kind of disease over the last 2-3 years? What kind of lifestyle diseases is your family susceptible to? Are you guys a fit lot, or are you obese, overweight, at risk of lifestyle diseases? So it's a bit of a qualitative take, yes, I agree. But then again, figure out, rate your family's health condition on a scale of 1 to 10. 1 being really, really bad, 10 being you're super duper fit. Now go on to factor that into that 20 lakhs that you arrived at. What you need to do is you need to buffer that health insurance cover of 20 lakhs, or you need to reduce it by anything from 10 to 25%. For example, if you guys are super fit, super healthy, haven't been hospitalized, touch wood, for the last 2-3 years or God knows how long, what you can do is you can reduce this 20 lakhs by up to 25%. So you can bring it down to, let's say, 15 lakhs. Similarly, if you guys are unhealthy, or unfortunately you don't take good care of your health, have been hospitalized in the past, you need to take an additional buffer on this 25 lakhs of up to 25%. So buffer this 20 lakhs up to 25 lakhs. So there you go. For a normal family living in Delhi, your health insurance requirement for you, yourself, your wife, your 2 kids could then range somewhere between 15 and 25 lakhs, depending upon the health condition that your family has at the moment. So that's a simple thumb rule. Just a quick recap: calculate the cost of a CABG surgery at the hospital of your choice, buffer it by anything from 10 to 25% depending on your health condition, and voila, you've arrived at the optimal health insurance cover for your family. Moving on to burning question number 2. Burning question number 2 is, should you take a family floater plan or standalone insurance policies for each of your family members? For those less aware, let's spend a very quick moment understanding what these 2 types of plans are. So let's say you've got you, your wife and your 2 kids, drawing on from the previous example. You have a choice, and let's say now you've arrived at 20 lakhs. Okay, so I need 20 lakhs of cover. You've got a choice, right? You can either take individual policies of 5 lakhs each for your family members, or you can take one policy of 20 lakhs with a cover that floats between your family members, which means that 20 lakh cover can be utilized on demand by any of your family members, and as and when that cover gets reduced or extinguished, the remaining cover can be used by anyone else as well. So for example, let's say you've got a family floater cover of 20 lakhs and God forbid a medical emergency strikes and you incur a cost of 10 lakhs. Your overall cover reduces by 10 lakhs and now you've got a remaining cover of 10 lakhs that can be utilized by your other family members. Versus, had you taken individual standalone policies for your family members, you would only be reimbursed for up to 5 lakhs for one family member and would have had to pay 5 lakhs out of your pocket. So I promised you a thumb rule to decide whether you should be going in for individual plans or a family floater. And before I arrive at the thumb rule, I must tell you that there are two important considerations that you need to know about in this regard. First, the cost of a floating cover is actually lesser by 10 to 20% than the cost of taking individual coverages for each of your family members. So which means the cost of taking a 20 lakh cover that floats is going to be lower by 10 to 20% than taking up individual policies for each of your family members. Second, and this is something that a lot of you don't know, very, very important to know, the cost of your overall family floater is priced based on the age of the eldest family member. So what does this mean? This means if you add an elderly family member to your family floater, the cost of your overall policy is going to go up sharply. So keeping these two considerations in mind, I'm going to give you the thumb rule now. If you're a young family, and by young family, I mean a family where the eldest family member is anything up to the age of 45 years old, go for a family floater plan blindly. There's a very, very slim chance that more than one of your family members will be hospitalized in the same year in any case. The probabilities are like minuscule. The other important consideration is having a large floating cover is better for your young family because God forbid there is a medical emergency that consumes a very large amount of money. You won't have to pay anything from your pocket. So you're ready for big size medical emergencies that could have otherwise set you back dramatically. And you're also playing on the fact that as a young family, there's a very, very slim chance that more than one of your family members would have to be hospitalized, God forbid, in the same year of your policy.